Welcome, everyone, and thank you for joining us for today's webinar. My name is Jerry Zeidenberg, and I'm the publisher at Canadian Healthcare Technology magazine. Today, we are presenting Caring for Our Caregivers, how we can use technology to support our healthcare workers, and it's sponsored by Ascom. Just a little housekeeping before we get started. Please feel free to use the chat function to comment on the information you're hearing and to communicate with your fellow attendees. As well, if you have questions for our panelists, please use the Q&A function. We'll raise the questions at the end of the presentations. We're going to record today's webinar, and it will be sent to all the registrants shortly afterwards. We'll also post it on the Canadian Healthcare Technology website. Now we'll get down to business. Today we have three panelists, each of them an expert on using technology to assist clinicians in the healthcare workplace. First, we'll hear from Dave Gutillo, who is Senior Regional Director of Alliances at Ascom. Dave?
Hey, thanks, Jerry. Appreciate it, and good afternoon, good morning, wherever you may be today. So as Jerry mentioned, we're going to be talking about how best to care for our caregivers and how hospitals can use technology to support our healthcare workers. And we recognize that creating better outcomes is really more than just an aspirational theme, and it's actually part of our mission here at Ascom. So I'm going to go ahead and level set on the agenda for today, and I'll start by providing some introductions to the rest of our presenters. We'll then set the stage, highlighting some of the challenges in acute care that we've gleaned both from industry data as well as a recent survey of nurses that we did from Ascom. And we'll then spend a little bit of time looking at Ascom solutions in action with some acute care use cases and workflows. And then we'll learn about what nurses really want from technology in healthcare. Finally, we'll wrap it up with a Q&A session. So my name, as Jerry mentioned, is Dave Gutillo. I serve as a regional director here at Ascom for Healthcare Alliances, managing our IDN business. I spent the first decade of my career in patient care. I was a registered nurse in critical care. Later on, I served as a program coordinator and a program manager in cardiovascular services. And then over the last 20 years, I've been a healthcare sales leader, a business developer, and spanned all kinds of roles. You know, I've done enterprise sales, sales management, program development, and been involved with a number of international companies. So I'm going to take us through the first portion of the webinar. I'll discuss some of the challenges and drivers in healthcare that are affecting today's caregiver landscape. We're also joined by Julia Greer. She serves as Ascom's Vice President of Clinical Strategy and Consulting. Hello, Julia. Julia is also a registered nurse, has worked in a number of different disciplines, including pediatrics and pediatric oncology, as well as other clinical areas. She later transitioned over into medical devices and software sales, and glad she's in that role now. Later in the webinar, Julia is asking to take us through some of the use cases and the workflows and actually show how optimized technology and processes can serve as enablers to help improve both the clinical and the patient experience. And then last but not least is John Sola. John serves as our Senior Product Manager with Ascom. John has been a marketing, product management, and business development leader in healthcare communications for over 25 years. He's got an area of specialization in nurse and emergency call systems, RFID-based technology, alarm management, and clinical communications. So John's actually going to bring the discussion together with an overview of Ascom solutions to show how we can promote better care delivery while, again, supporting our caregivers and the patients that they serve. So with the agenda and introductions behind us, let's dive right in. And I trust this is going to be an information and engaging webinar for you guys today. All right, so I'd like to take just a minute, if I could, to share a little bit about Ascom and how we serve healthcare and other industries. For those of you that don't know Ascom, we're a global solutions provider. We're focused on communication, collaboration, mobility, and workflow optimization. We've been in the business for more than 35 years, and our vision is really to close digital information gaps that allow us to drive the best possible outcomes anytime and anywhere. Our mission is really to transform data into actionable insights to improve patient outcomes and enable more effective delivery of care. And we do this through a unique and differentiating portfolio of solutions and services that are really designed to integrate, orchestrate, and enable. And by the way, those are themes you'll probably hear throughout this session. Seamless communication and collaboration workflows across a variety of industries, including, of course, healthcare, manufacturing, energy, and hospitality. We're headquartered in Bar, Switzerland. We have operating businesses in about 18 countries, and we employ around 1,300 people worldwide. Beyond the fast facts that you see on the slide here, I think as it relates to healthcare, specifically in North America, Ascom is in over 2,100 hospitals and health systems. That includes about 44% of US teaching hospitals and about 50% of the top US hospitals. A couple of recent points of pride. This year, Healthcare Business Review magazine named Ascom Americas as one of the top 10 healthcare consulting companies. We were also named a top 100 healthcare technology company by Health Information Technology Report. And most recently, Ascom received a Global Industry Award for Best Practice in Medical Device Connectivity and Technology Leadership by Frost & Sullivan. So now that you know a little bit more about Ascom, let's bring this closer to home and talk about the challenges that our clinicians are facing today. So healthcare organizations are really at a critical crossroad. I think a lot of you know this already, right? The Great Resignation is no stranger to the nursing and extended care team professions. I've looked at a number of surveys, I'm sure you all have as well, but just to cite a few, McKinsey & Company says that in the last year, 90% of nurses have actually considered leaving the profession. Elsevier Health, as reported by a Forbes article, indicates that 47% of healthcare workers plan to leave their current roles by 2025. And just to kind of give you some context what that might look like in terms of the numbers, I looked at another report that also stated 2025 departures and that 47 percentile that I gave you. But what that equates to, and this is from Mercer Analytics, is about 446,000 home healthcare aides, 95,000 nursing assistants, 98,000 medical lab technologists and technicians, and 29,000 nurse practitioners. And then finally, if that's not enough, I looked at an article from the American Nurses Association that said the current need for nurses is about 3.4 million, which is about a 20% demand increase over our current staffing levels. So obviously this is not a sustainable trajectory, and it's really an imperative that we have to address this as a society. So let's turn our attention over to some of the specific challenges around clinical communication and collaboration that we think are fueling clinical burnout, cognitive burden, and staff attrition. So through industry experience and in general observation and discovery with hospitals and health systems, one of the key things that we see is that clinical communication and collaboration still tends to be siloed. Many of our clients, due to a myriad of reasons, have communication infrastructure, tools, processes that are still piecemeal and independent of each other. And while there may be some level of connectivity, there's really not a true communication ecosystem. And this lack of connectivity, interoperability, and/or integration really creates islands of information. Many of these changes and challenges are systemic, and they tend to be cyclical, that result to both impacts in patients and staff alike. That study that I alluded to earlier from Elsevier Health also cited that we need to future-proof healthcare, especially in the effective use of health data and technology. And this is exactly what we're doing here at Ascom by integrating, orchestrating, and enabling data into actionable insights to really help our clinicians do more of what they do best, which is care for their patients. So I want to dive just a little deeper and hear from actual clinicians in what matters most at work. Recently, Ascom surveyed about 500 nurses, actually greater than 500, nationwide to understand what hospitals and healthcare systems can do to relieve the nursing shortage and improve nursing satisfaction. The results validate the feedback that we hear almost every day from nurses. Take a moment to review these impacts that you see on the screen. Do you agree or disagree with these findings? Would you possibly rank them differently? Be curious to know. Well, while we may not be able to directly impact nursing salaries, we can certainly move the needle on making nursing jobs easier by providing technology to promote nursing satisfaction and using that technology to improve clinical efficiency so that our nurses have more time with patients to focus on informed care delivery. So just how important a role does technology play in clinical employment decisions? Well, if we drill down into the second impact from our survey, we also found that nearly 60% of nurses say that a hospital's suite of technology tools is an important factor in deciding where to take a job at a particular hospital or health system. As nurses are expected to do more with less, we do see technology as part of their essential tools to do the job. In fact, nurses actually report that they're better at their jobs thanks to technology. So why is technology such a big deal? Well, let's talk about some direct impacts that can literally make or break the clinical and patient experience. Not having the proper technology can have real impacts, from cognitive overload to alarm fatigue, from increased fall risks to medical errors. And the list could quite frankly go on. But it goes beyond just the proper technology. We need optimized processes and workflows that are enabled by technology to deliver the right information at the right time without unduly burdening clinicians with information that does little to help them make informed decisions. I recently published a blog for Ascom on LinkedIn titled Combating the Syndrome of More. In that blog, I discussed how clinicians are being asked to do more with less. Clinicians face cognitive overload due to the sheer volume of daily calls, texts, alerts, alarms, and notifications that they have to contend with. Add to this that they're assimilating complex or incomplete information from multiple sources like patient monitors, ventilators, and a litany of other bedside technologies. And finally, let's not forget, they still have to assimilate data streams from ancillary clinical systems like lab, radiology, and pathology. It's really no wonder that the consequences of these impacts are proving out in the Great Resignation. I'd like to know what impacts you're experiencing, and perhaps you can provide that in the chat as we go along. So the question really then becomes, how much longer can we expect our caregivers to sustain these impacts? And what about their patients? Well, with that, I've set the stage for the discussion. I'm going to turn it over to Julia, who can walk us through some of the use cases and workflows to show how Ascom is caring for our caregivers. Julia?
Thank you. So what is it that we all dream of in taking care of our patients and having them move perfectly through the system and come out better than they were when they came in? Ultimately, that's our goal: end-to-end continuum of care with the best possible outcomes. Now, we all know realistically that that doesn't always happen, but we want to discuss with you today what we have to offer through our Ascom Healthcare Platform to help with some of these things and to bring data together and help you work smarter and more efficiently. So let's move on and take a look at the key segments of the Ascom Healthcare Platform. So this slide has some animations on it, and the first one that's going to come up is staff safety and personal alarms. With today's news stories, I don't think there is anyone who is on this webinar that has not heard about the recent death of several nurses. And I'll talk a little bit more about this later when we really get into some workflow examples. But we take it very seriously, excuse me. I apologize. We take it very seriously that we want all staff and patients to feel safe when they're in our care. The next one is collaboration. I think when we, as care providers, nurses, nursing assistants, physicians, we're kind of all each in our own world doing our own little thing and getting back to each other when we can, kind of piecemeal. What you're going to see today are examples of how we can collaborate with each other through many different devices, all connected in and as a part of Ascom, or as perhaps another vendor's piece that you already have. So we're really going to focus on how important it is for the physician and the nurse to have some quick and rapid conversation. The next one that we're going to review is nurse call. Nurse call is not what it used to be. Or maybe I'm dating myself. Nurse call used to just be patient pushes a button and a light went off, and a code blue button. Well, nurse call now has many, many new additional features. I like to refer to them as smart nurse call, because that nurse call is the only connection that patient who is in that room alone has to reach their care providers. So we will definitely investigate that more and talk about it in more detail as we go through some potential use cases. The next category is alarm management. And I'm still waiting to find the hospital that has perfectly figured out alarm management. I am blessed, however, in my position to travel around North America and observe and learn and compile what we see as best practices and what works for different settings and situations so that we can control this amount of alarming and alerting and informational pieces of data that come in. It's just huge. Dave talked a few minutes ago about the cognitive overload of getting all of that information. So we want to help people make smart alarm management decisions. And that's a part of what our clinical consultation team does, is to come out and work with you, understand your situation, where you are today and where you want to go, especially around cardiovascular types of alerts. But it's not just those, it's every other device that's in the room. And the last one of these we're going to review is clinical decision support. If we have effective collaboration, smart nurse call, and alarm management, I have all the pieces I need to use clinical decision support tools. We can help you with an existing decision support system that you are using, or we have algorithms that we can work with you for you to choose your specific parameters. And again, we'll talk in more detail about these as we go through the use cases. So my next few slides will dive deeper into the common workflows. So let's take a move here. All right, care collaboration. Again, I just mentioned that this is where we have the ability to communicate with the entire team. So an example that we have in this particular case is a nurse has gone in to assess a wound with a patient. She sees that maybe it's not looking quite right. With her smart device, which is a portion of the Ascom portfolio, and also other companies' devices that we can use. But again, if you go Ascom, you're Ascom all the way through. But I always want to make sure to emphasize that we are a vendor neutral company so that we can work with some of your existing things. So this nurse has made this assessment. She doesn't like what she sees. She takes a picture of this image. She then is able to message directly to the patient's physician or nurse practitioner or hospitalist and send it directly to that person. And where can that person be? That person can be, as you see here, sitting in front of a computer and looking at this conversation, or they too can look at it on their mobile device. Once this advanced practice colleague takes a look at this, he's like, oh yeah, let me ask a couple questions and see exactly what's going on so I can make the appropriate recommendations. And again, at his fingertips, he has the ability to communicate by secure text. It's completely secure. That's one of the things that we are also very proud of is the way we run our networks. That allows us to do some very interesting government work as well. Not all folks have that kind of clearance and ability. This position is, again, either texting back to the nurse on the computer, his smartphone. They have a chat. He's like, oh, this chat just isn't doing it. It's a simple touch to convert it to a phone call. The nurse and the physician, advanced care provider, make a decision about what they think they should do. The nurse then knows to go and gather the appropriate supplies to take to the room to carry out what the physician has asked. At the same time, perhaps from that computer that the physician is sitting at, he may well have entered the actual orders. So with that, I want to probably just mention that every clinical situation, it's not always just about wounds. This could still be involving child abuse, domestic violence, severe injuries, traumas, anything that you need pictures of, and getting those pictures into the medical record to go along with that. And collaboration can be around any situation. It doesn't have to just be this. It could be around collaborating between what room is clean and what room is dirty. It can help you move your patients through ER faster and through the ORs faster, because we all know that time is money, and those beds being occupied or not able to be turned over is a very difficult financial burden for hospitals. So with that said, let's lead us into the next topic of clinical decision support. So you just saw the example of having the collaboration between multiple people, or the care team surrounding a patient. You can get all of this information from various places. In the picture of the patient in the room, you can see that we are gathering information from the IV pumps and from a ventilator. We could have other medical devices in this room, and this information is all fed into our clinical decision support system, or one that you already have in place. This allows us to then get the assigned nurse to get the specific message about this patient. When she can see all those details either on her handset in a smart display, and can see all of the alerts at the same time, she can go, oh goodness, this alert, yeah, I need to go take care of this one. These other things are not so bad. Let me call in and get everything I need to take to this room at once, so that I can talk before I walk. Another place that this can be displayed is as a dashboard. It can be placed in nursing units, hallways. Yes, we can adjust those for HIPAA compliance, certainly, so that we're not identifying patients inadvertently on one of these boards, if you so chose to put it in a hallway. The picture is small, but I think you can be able to see that there's one that's red and there's a couple that are yellow. That red is telling me that I've got several factors going on here. What do I need to do? Something's off. The clinical decision support has put this patient in a red category. You also see a few that are yellow, that a few things are off, but not anything that's going to cause a major response team or the call to a response team. The nurse also has the ability, again, from the collaboration, to communicate directly with the doctors of these degenerations of the patient, their deteriorations, and the ability to collect the rest of the team and go to the bedside. It could be to just ask for another advanced nurse to go with them and check out why this patient is having all of these issues, leading us to think that there is a complication coming. This particular one is talking about sepsis in the emergency room. We all know that certain patient types come in and you can look at them and say, this patient is at high risk for sepsis. You start checking them in, you get these alerts. You can quickly activate your sepsis protocol. Again, those mobile devices, those centralized stations allow you to get that information to who needs it to get a quicker response. This same thing can be used in a med-surg type of unit. I think we all worry about staffing med-surg units these days, and so many new and young nurses and the older nurses retiring out, that there's not as much experience, and that this extra piece of support to tell them, hey, something might be going on. You might want to seek some advice and check out what you need to do to protect this patient. In med-surg, if we can just prevent a few patients from getting an unexpected return to an ICU unit or an immediate readmission, those again are all impacting our patient outcome and their satisfaction. So let's go ahead and what do we want to talk about next? I think we want to move on to clinical monitoring and alarm management. I mentioned at the very beginning that I'm still waiting to find the perfect solution for every alarm, what's important and what isn't. And I don't know that any hospital can demonstrate that. And I'm not going to promise you that we as a company can get it perfect. But we have some seriously great examples and ways to get this information to you through consultations. So this is a simple basic one here on the screen. We have a patient who is on some form of isolation in an ICU room, and they have a monitor going off. Well, if this patient is in isolation, we have to don and doff all of that personal protective equipment to go in and out of this room each time. Well, how convenient for me is it if I can see what that device alert is on my phone before I go there? Another example of talk before you walk, gather the appropriate supplies, talk to the appropriate people, and then you can cluster your care and lower the number of times that you have to go in and out of the room, as well as saving yourself many steps and time. And that time is valuable. Not depicted on the slide, but something I want to just I want to help you figure out how to utilize delays in certain alarm and alert types. Perhaps you don't need an SpO2 alarm because it dropped 2 percentage points for 4 seconds. Maybe you can talk about putting in delays of 10 seconds, 15 seconds. We have amazing data that can show you that by delaying it for that 15 and 30 seconds, at 15 seconds, it decreased unnecessary SpO2 alarms by 30-some%. And by going to 30 seconds, it decreased those nuisance alarms by 60-some%. Interestingly enough, sometimes you want to filter these alarms so that if I have both a drop in heart rate and a drop in SpO2, that will come to me as a single alert rather than 2 separate ones. So we want to work with you through all your alarming situations to make sure that we are doing our best to decrease that just bombardment of the phone constantly sending alerts. I think you can also pull up many statistics that will tell you that 90-some% of the things that land on a nurse's phone are really not the most important things. Let's focus on that 10 to 15% that are the most important and help eliminate the unnecessary parts. In this example, again, you see that the patient had the high blood pressure from the alert, and the nurse again was able to speak with the physician, get the order, and take that medication in. So again, you see this complete one here on monitoring and alarm management for this particular situation, but there are many departments that do this and could use some really good help in designing what their alarm management system is going to be. And if you don't have an alarm management committee, it's something you definitely would want to do. And those are folks that our clinical consulting team would also want to meet with, is the monitoring committee and the actual people from each unit, to make sure that they're all on the same page and that we can supply the solution that you are interested in. I don't think there's any question that we can all agree that alarm fatigue is just overwhelming, and that we need to find ways to make this better, not just for the nurses, but just the volume and the noise in the units for the patients. So this next topic I'm going to go to is a little bit related to this one in the fact that it's response team management. You'll see in this particular example on your screen that it is happening in an obstetrics unit. The fetal monitor has detected fetal distress. The nurse and midwife are notified. Again, we're using those phones. We're going to be able to communicate on the go, as this could be very, very time sensitive. Able to use that phone to activate a team. They have a specific team that will come for emergency cesarean sections. It could include neonatology, it could include anesthesia, it can include the obstetrician, so that you get who you need as fast as possible. I'm kind of near and dear to children's and women's and children's health. I worked labor and delivery many years, and it was a key indicator for our performance of time from decision to incision for getting that baby out safely. So this one is one that I always like to talk about. But let's talk about other ways that teams can be configured in our system. We can set up teams related to code blues, rapid response, IV team, whatever team you have in your facility that needs mass communication. We can provide in-device, the middle software that is going to navigate it, and the assignment piece that is going to associate the proper people to each of those teams. The other example of how we can utilize teams is within units, nursing units. Those units may be very large and have wings that A wing only wants emergency calls for the A wing, and the B wing only wants those for B, versus sending code messages or heart rate alarm messages to people on both sides because of an escalation path. We can help you divide that and split it, again, decreasing those number of alarms. So we utilize teams in multiple ways, not just to activate teams to come to the rescue, but to work within a team of nurses for a designated area or unit. So I think that teams were something that we all used to do. Then we went to primary nursing, and now we're seeing teams coming back a little bit more. So if you are considering those things, it's certainly something that we can help you discover and discuss and build the teams that are right for you. So now let's take a look at nurse call. So I said in the beginning, nurse call is a far cry from where it used to be. We don't just let a patient push a button and a light go off and it ding at this clunk of a phone and a screen and console is what we call it now, where someone can answer it. A lot of things have changed. The patients want more control within their room. Again, it's their only way to reach out to their care team. So they want to be able to ask specific things. Maybe you have pillow speakers now that are labeled with different options on it. It may be, I need a pain medication. I need to go to the bathroom. I want water. We can also provide very specialty hand pillow speakers for the patients that can even control the lights, the blinds, the door, the TV, the music system, the education system. So certainly nurse call in that respect has changed greatly. And of course, we all always have to remember that we have to have things for our impaired patients that aren't able to use their hands to press on a button. So of course we offer the sip and pulse and pressure pads as well. So once the patient has put out a request, it's going to go and ring to the nurse. It will always go to that console. It is a mandate that it must go to that console. When the nurse picks up on her phone, she can talk directly to the patient. By speaking to the patient, this again allows me to talk before I walk. It lets me find out the rest of the details of what they want from the call that came in that said I wanted a pain medication. The nurse can say, "Hey, Ms. Smith, I see you requested pain medication. When I get that, is there anything else you would like me to bring?" She can then gather those things and cluster her care. Once the nurse has gotten those things together, she can go directly to the patient's room and take care of those items. So as you can see, Nurse Call has come a long way. We have devices for task management that are a part of Nurse Call and rounding. We have medical device connectivity through certain types of Nurse Call additional pieces. The next thing I'd like to go ahead though and do is make a statement about just because a technology can do something doesn't always mean it should. And that applies to Nurse Call, that applies to alerts and alarms from various pieces of equipment. We need to make smart decisions about what are the things that are really important and not getting caught up in the weeds of all of the things that we are not going to take an action for. So important, actionable. Let's filter out some of the extraneous things. So I think we've talked a lot now about Nurse Call and talk before you walk. So what I'd like to do is go to my last topic about workplace and staff safety. I think this is on the mind of everyone right now. We have just had so many incidences of violence against nurses. You will see that I have, oh, I don't see my little link. There's a link on this slide somewhere, and if it's not there, we will get it there. But we want to provide the information to you about how you can use the products you have to increase not only the safety of your staff, but your patients. We have the ability to put personal alarms on devices. If this example shows a patient family is misbehaving, is getting violent, getting loud, whatever the case may be, we have the ability to activate that button. That button can then reach out to other staff members on the unit to come to them. It can reach out to security departments. It can reach out to police departments. We will help you set that up. The other really neat thing about it is it can be a call that opens up audio so that people can hear what is happening in a patient room that has an issue, or they can just leave it in a silent, in a conversation mode. So lots of options of how to utilize those buttons that are programmable. And we have more than one on the device, so lots of options there. And I just think it's so important. You know, in the news, we've just seen the deaths of nurses. And if you have not seen them, I'd ask you to Google it, and we'll be sure to get that link for the website that talks about the fact that in the United States, in the second quarter of 2022, over 5,000 nurses were assaulted. It turned into averaging out about 2 nurses or care providers per hour are having an incident of assault. We also believe that that number is very low because a lot of people don't report simple things that really are assault. We all know that we step away and don't think about it when somebody just pinches or bumps into us or yells at us. We think those things are not even included in those statistics. It's a huge and alarming thing happening in the world of patient care. So as we transition into the last segment of our presentation, the workplace safety, I think we have talked about everything here, and I do not see that link yet. So we'll get it up there to you, guaranteed. But at this time, we're going to wrap it up, and I am going to take this over and let John Solo have a few words.
Thanks, Julia. Really interesting information there in the workflows that you shared, and especially appreciate your clinical insights along the way. So those challenges that she described correlate very closely with this question that we asked the nurses in our survey. We asked them to rank which technology tools and solutions were most important in helping them to do their job well. And what did we learn? We learned that technology certainly plays a prominent role in helping them in that way. And even beyond that, it can play a role in their selection of an employer. So with that, let's go to the next slide and we'll have a look at the results from the nurses' ranking of solutions. First, nurse call. More than 1/3 of the nurses who responded to our survey ranked nurse call as the #1 technology tool they needed to do their job well. From our perspective at Ascom, we agree this is a very important technology, not only from the standpoint of it being a code requirement, but we really see this as an opportunity to transform an existing nurse call infrastructure into a patient-centered response system. And with that, there's access to inputs to clinical data, interoperability across devices, systems, and applications. We think of it really as a point of care technology hub, where modularity is important and the ability to facilitate workflows. And Julia talked about some of these already, things such as task management, predefined workflows, such as the ability to schedule rounding, to affect patient throughput, or even to engage response teams. And then communication. Communication could be, for example, with labs, the front desk, maybe pharmacy. Another example could be smart bed integration, the ability to prepare for fall prevention, being able to understand the conditions that are present at the bed at any point in time. And then lastly here, medical device connectivity and the ability to connect to devices, transport and carry that information, not only to mobile caregivers, but also to dashboards and writing that information to the EMR. Really, I think the important takeaway here is that nurse call should provide comprehensive communications. And of course, the more modern and modular it is, the greater the return on investment. Next slide, please. All right, nurses rank predictive analytics #2 on our list at 22%, in reference to what they viewed as the most important technology tools. You'll also see on this slide clinical decision support, and that also had a very strong response at 18%. And this aligns very closely with the analytics part from a communications and workflow perspective. If you're wondering what a clinical decision support system is, also known as CDSS or CDS, it's a health information technology system designed to provide physicians and other health professionals assistance with clinical decision making. Really, the aim here is to reduce the cognitive load on caregivers. If we go back to what Julia spoke about, I think one of the good examples here of this could be the management of sepsis. And of course, most hospitals have defined protocols regarding sepsis. but that condition may not be diagnosed quickly enough to save a patient's life or avoid a lengthy stay in the ICU. And a CDSS can be deployed to apply hospital-defined clinical governance rules to the multiple streams of information, such as vitals and lab results, and then provide an output as an indication to a caregiver. At Ascom, we see CDSS in terms of aggregating and complementing data from monitoring devices and the EHR, and then distributing or decentralizing that information to the point of care via dashboards or even straight to handheld devices. The result is near real-time information and also guidance provided to help monitor and improve patient outcomes. It's based on best practices and evidence-based medicine. We know this is vital in care areas where rapid response is critical, or everything for that matter. But even in general care areas where early detection can prevent more serious deterioration and the need for acute treatment. And we'll go to the next slide, please. Oh, back one, I think, please. There we go. Now, collaboration and secure communications also rank very high, rank 4th in our survey at 14.4%. This category is often referred to as clinical communication and collaborations, or CC&C. And this encompasses voice, messaging, alerts, video, tasks, and the applications and devices that are required to enable this. What makes this clinical, of course, is the fact that it's designed to be used by clinicians and staff for patient-centric communications. And that's activities such as sharing patient information, receiving alerts, care transitions, setting task reminders, and much more, of course. Generally associated with smartphones and apps. However, voice over Wi-Fi and DECT handsets, like you see in this in the top image of this slide, are highly capable devices for facilitating voice alerts and also the personal safety that Julia alluded to. Given this technology's wide range of applications and the mediums, I should say, it's maybe a bit surprising that it didn't rank higher on the list, but there could be many factors. It might just be the relentless pace of technology change, different standards, IT systems that don't always integrate, other barriers to communications. But at the end, I think the goal here is to ensure that clinicians and staff aren't resorting to scribbling notes on paper or having to, walk to a stationary PC or even postponing notations due to technology restraints. Now, from Ascom, from our perspective, we think in terms of enablement or empowering mobile staff. So creating an environment where clinicians can view, manage, share, and augment clinical data. And that would be either on the go or at the bedside. One example would be a nurse using an Ascom app to calculate an early warning score or applying best practice rules to upload the results to an EMR from a patient's bedside. And that's an example that is the capability for enabling a phase at work. But in the end, it's important that communications and collaboration contribute to improved safety, outcomes, satisfaction, and retention. Next slide, please. So with 96% agreement, nurses were very clear here in the survey that the addition and use of technology solutions helps them provide better care. Here you see the perspective on technology from one of Ascom's customers, Kristen Robb at Providence St. Joseph Health in Southern California. She talks about the benefit of integrating technologies, including nurse call, alarm management, and smartphones, and how in the end it helped them realize their vision of having one platform rather than multiple devices and systems. Next slide, please. And to accompany the survey, I'd like to share with you a case study that we did at Ascom. And we think it was an exploratory case study of an acute care facility customer in Southern California. And it was focused on the effect of alarm filtering in the context of alarm fatigue. And of course, that topic has received much attention as of late. And Julia alluded to this in some of her notes as well. So Ascom's clinical team consulted with this customer to identify which alarms should be deemed actionable and where filtering rules, and those could be rules such as grouping or delaying alarms, could be applied to further reduce the number of alarms presented to caregivers. And you can see they had some really spectacular results here, where they reduced the alarms from 7,400 before filtering to roughly 3,100 after filtering. And of course, the net result of this is fewer distractions, less work interruptions, and reduced alarm fatigue. And if we look specifically at alarm fatigue, this is often identified, as a serious threat to patient safety and also to staff well-being. It could be caused by prolonged exposure to non-clinically significant alarm notifications, and it can lead clinicians to potentially have to deprioritize significant alerts. Again, as we see in this study, strategies to combat fatigue will pay dividends. And with that, I'd like to turn it back over to Dave and let him share some valuable tips and information to ensure your success when implementing a new technology. Thank you.
Thanks, John. Thanks, Julia. Great insights from both of you. Appreciate all of the detail. This is a build slide, so I'm just going to let it build out, and then I'm just going to speak to this for just a minute. We don't really believe that it's a one-size-fits-all approach for design and delivery for solutions. Every hospital and health system is unique in its requirements and its needs, and the best way to really approach this, in our opinion, is exploring the right fit based on comprehensive and consultative discovery. When we look at unique and differentiating positioning with our clients and our prospects that we have the opportunity and pleasure to work with, it's really around an outcomes-based business framework that separates us from a lot of partners that are out there. And this 6-step process that's outlined on this slide is really just kind of designed to highlight this end-to-end business framework that is designed to ensure we deliver measurable value for you. So we're ready to engage with hospitals and health systems when you're ready, and we would look forward to the opportunity to work with you and help care for your caregivers as well. Again, I think this is a really important topic. We're so delighted that we had the opportunity to spend some time with you today, and we appreciate everybody's engagement. I'm going to go ahead and turn this over now to Jerry. I think, Jerry, you're going to open it up for Q&A, right?
Yes, thanks, Dave. We have time now for a few questions. And the first one is, what is the escalation process for, as an example, a patient requests pain medication, but the primary nurse doesn't acknowledge the request within a set number of minutes?
Yes.
There's someone who cared to comment on that.
Sure, this is Julia. I'll be glad to talk about that. We utilize something called role-based assignments, and we have escalation pathways from first person to second person to third person. So obviously a pain request needs to go to a nurse and not a nursing assistant. So we would talk with you about what is the appropriate amount of time. Phone rings. I see my patient wants pain medicine, but I can't do it. I'm sterile. Can't touch my device. It will automatically roll to the next nurse that we have put in the chain for pain requests. If she doesn't get it, it can then go to a third level. Again, we will talk with you about what are these times for escalations. And I will be the first one to tell you that everybody thinks that every call should be answered in 30 seconds. You can't. You just don't have the ability to pull a phone out of your pocket or stop what you're doing, get your phone out, read it and respond to it. 30 seconds is too short. So we'll talk to you a lot about what are we seeing in North America for escalation tasks. But absolutely, we will customize those, whether it's a pain call, a potty call, or just a general, I push the basic nurse call button that you don't really know what they're requesting from that point. But absolutely, we set up those chains and build them according to you and your roles within the hospital.
Okay, that's great. Thank you, Julia. Another question asks, how do you manage software updates so that they don't disrupt access to the technology across all platforms at any given time of the day? Question about updates.
Yeah, Jerry, this is John. This is John. I can respond to that. It's a good question, important question, obviously, in terms of uptime. So this, our partners, if you will, and also, professional services within Ascom would obviously work very closely, with the IT teams, at our customer locations to plan, plan that process in advance, ensure that we can minimize the downtime, related to this on core applications. It is a premise-based solution. So there is going to be, a local upgrade that needs to take place. In addition to that, of course, we're now in an app environment that we're dealing with. And so typically, there's going to be mobile device management in play that serves as a gatekeeper, if you will, for distributing new app updates, pushing new app updates out to customers. And so we, work very closely with our customers in that regard. We also can allow an opportunity for closed track testing for them to be able to, give that a opportunity to use in their environment before a full push would be out to all of their users. So there's obviously we work closely hand in hand to ensure, minimal interruptions.
And just a secondary comment to that too, for those customers that are partnered with us, we offer long-term software maintenance agreements, and within those agreements, we provide test system licensing so that you can set up a test environment outside of a production environment to mitigate any risk before a push goes out into the production environment. So something to think about as well.
Okay, excellent. And I think we have time for one more question. We have a question asking, what if I'm already using another technology solution? How would you address this one? How do you fit this in if some aspects of Ascom are very appealing to the customer and maybe they're components of their own system they'd like to keep? How does this all work together?
Yeah, Jerry, this is John. I'll respond to that. I would say first off, of course, we would work with the customer to evaluate where we can complement the technologies that they have in place with what they currently value or are satisfied with, and then look to fill in gaps along the way. I think the key to that is, from our perspective, would be interoperability. It's critical, I think, to the success of technology solutions. From our perspective, we're vendor agnostic and standards based, so we can work together with just about any other device or system that's out there. Whether that's through standard protocols like through the IHE standard, or whether it's through sharing and exposing APIs for connectivity to different systems. So there's where there's a will, there's a way to work these things out, and it's an important part, I think, in today's technology world to have interoperability.
Okay, super. And I think we're just about out of time now, so thank you, everyone. We appreciate you being here. A recording of this webinar will soon be available, and we'll send it to everyone who registered. It will also be posted on the Canadian Healthcare Technology website a few days from now. Thank you again for joining us.
Thanks, everyone.
Thank you. Have a
Thank
good
you.
day.